If you're trying to memorize every glycogen storage disease, you're doing way more work than the boards expect. Boards don't test whether you remember enzyme names, they test whether you recognize patterns. In this video, we're going to simplify glycogen storage diseases by asking one question: where is glycogen failing to be used? Glycogen exists mainly in three places that matter for boards: the liver, the muscle, the heart. When glycogen can't be broken down properly, the symptoms are going to tell you which organ is affected. Once you know the organ, then the answer choices narrow. Let's start with the liver. The liver's job is to maintain blood sugar during fasting. If glycogen can't be converted into free glucose, patients develop severe fasting hypoglycemia. That pattern is going to point you toward type 1 glycogen storage disease, or von Gierke's disease. Von Gierke's is caused by a deficiency of glucose 6-phosphatase. Because glucose can't be released into the bloodstream, glycogen builds up in the liver. Clinically, these patients present with severe fasting hypoglycemia, hepatomegaly, lactic acidosis, hyperuricemia, and hypertriglyceridemia. Board clues include symptoms that appear during fasting and improve with frequent feeding. If the question stem emphasizes hypoglycemia after fasting, think liver involvement and von Gierke's disease. Next, let's shift to the heart and muscle. When glycogen accumulates in the lysosomes, you should think about Pompe's disease, also known as type 2 glycogen storage disease. This disorder is caused by deficiency of lysosomal acid maltase. Glycogen builds up inside the lysosomes, especially in cardiac and skeletal muscle. Clinically, Pompe's disease presents early and severe. Boards will often describe an infant with hypotonia, muscle weakness, and cardiomegaly. The classic image is a floppy baby with a large heart. If cardiomyopathy is front and center, Pompe's disease should be your answer. Now let's move to skeletal muscle. Muscle glycogen is used during exercise, not fasting. When muscle glycogen can't be broken down, blood glucose stays normal, but patients develop exercise intolerance. This pattern points to McArdle's disease, also known as type 5 glycogen storage disease. McArdle's disease is caused by deficiency of muscle glycogen phosphorylase. Patients develop muscle cramps, fatigue, and myoglobinuria during exercise. Boards love the second wind phenomenon, where symptoms are going to improve after a brief rest and then resumption of activity. If the stem mentions exercise-induced muscle pain with normal blood glucose, think McArdle's disease. Here's the pattern summary you want to lock in. Liver involvement causes fasting hypoglycemia. Muscle involvement causes exercise intolerance. Heart involvement causes cardiomyopathy. Once you identify the organ system, you don't need to memorize the enzyme. Boards are not asking you to recite these pathways, they're asking if you understand physiology. Glycogen storage diseases become manageable when you stop thinking in enzymes and start thinking in organs. The takeaway is simple. If symptoms occur during fasting, think liver. If they come during exercise, muscle. If the heart is enlarged in an infant, Pompe's disease. Recognize the pattern, the diagnosis follows. Let's run through a quick case. In this example, we have a 6-month-old infant coming into the clinic for poor feeding and irritability. The parents report that symptoms are worse in the morning before the first feed. The infant has had poor weight gain since birth, and on physical, the patient has a protuberant abdomen with hepatomegaly. Labs show that we have severe hypoglycemia after an overnight fast, elevated serum lactate, and hyperuricemia. Triglyceride levels are also elevated. Which of the following enzymatic deficiencies is most likely the cause of this patient's condition? Is it a debranching enzyme deficiency, glucose 6-phosphatase deficiency, muscle glycogen phosphorylase deficiency, branching enzyme deficiency, or a phosphofructokinase deficiency? Let's talk through it. The way the boards want you to think is a little bit different than real life. So first, I'm going to actually ignore the enzyme names and just look at the pattern. This is a 6-month-old infant with poor feeding and irritability, and the symptoms are worse after an overnight fast. That immediately tells me this is a fasting problem, not an exercise problem. So I'm thinking about liver involvement, not muscle. Next, on exam, the infant has hepatomegaly. That reinforces that this is a liver glycogen storage disease. The liver is supposed to store glycogen and release glucose during fasting. So if a child becomes hypoglycemic between meals, something is wrong with that process. Now let's look at the labs. We're told that there is severe hypoglycemia after fasting, along with elevated lactate, elevated uric acid, and high triglycerides. That combination is very high yield. When glucose can't be released from the liver, glucose 6-phosphate gets shunted into other pathways, which explains the lactic acidosis and the hyperuricemia. If we put this together, infant, fasting, hypoglycemia, hepatomegaly, lactic acidosis, and hyperuricemia, that pattern definitely points to von Gierke's disease. So the underlying problem here is the deficiency of glucose 6-phosphatase. The liver can store glycogen, but it cannot release free glucose into the bloodstream. That's why these patients become severely hypoglycemic during fasting. Key takeaway for boards is you don't need to memorize every glycogen storage disease. You just have to look at these patterns. Choice A is a debranching enzyme. This is Cori disease, which can cause hepatomegaly and hypoglycemia, but it's usually milder. You typically don't see the severe metabolic derangements we're seeing here, like lactic acidosis and hyperuricemia, so this doesn't fully explain the severity of this case. B is glucose 6-phosphatase deficiency, that's von Gerke's, and that fits perfectly. Choice C is muscle glycogen phosphorylase deficiency, and this is McArdle's disease. That's a muscle glycogen storage disease. Those patients present with exercise intolerance, muscle cramps, and myoglobinuria, not fasting hypoglycemia or hepatomegaly. So we can eliminate this one right away. Choice D is a branching enzyme deficiency, or Anderson's disease. This is abnormal glycogen storage and progressive liver failure with cirrhosis, not typically presenting with severe fasting hypoglycemia. And then choice E, phosphofructokinase deficiency. This affects glycolysis in muscles and red blood cells, exercise intolerance, and hemolysis, not fasting hypoglycemia or hepatomegaly.